Hi, I'm Ellen and welcome to Mentally Detoured. This is when I remind you that I am not a mental health professional. For the topic today, depression, I have compiled information from various websites, but none of it is meant to diagnose. If you feel that you are suffering from depression or any mental disorder, please seek assistance from a professional. Depression. We've all heard of it. It's one of the most common mental disorders in the United States. In 2012, an estimated 16 million adults aged 18 or older had at least one major depressive episode in the past year. This represented 6.9% of all U.S. adults. People of all ages and all racial, ethnic, and socioeconomic backgrounds experience depression, but it does affect some groups of people more than others. Women are 70% more likely than men to experience depression, and young adults aged 18 to 25 are 60% more likely to have depression than people aged 50 or older. That women experience more depression than men may simply be that they are more likely to seek treatment. Depression is a serious mental condition that requires understanding and medical care and is treatable. Left untreated, depression can be devastating for the people who have it and for their families. Fortunately, with early detection, diagnosis, and a treatment plan consisting of medication, psychotherapy, and lifestyle choices, many people do get better. Some people have only one episode in a lifetime, but for most people, depression recurs. According to research by the American Foundation for Suicide Prevention, if the regular person can be taught to recognize signs and symptoms of depression and other mental disorders, they can help someone close to them receive the treatment and support that they need. This is important because among people who die by suicide, depression is more common than any other disorder. So what are the things we should be looking for? Everyone gets down now and then, so how can you tell the difference between just a bad day and capital D, depression? There are 9 specific symptoms that are considered when diagnosing depression, and if you have 5 out of the 9 with at least one of them being a depressed mood or reduced interest in life, depression could be your diagnosis. One thing to remember about mental disorders in general is that many symptoms overlap, making diagnosis difficult. For example, what looks like unipolar depression, what we're talking about today, which is a mood disorder with only depressive symptoms, it may in fact turn out to be bipolar disorder. And just to further confuse things, other symptoms of other disorders may also be occurring. This discussion is just about depression, however, and the 9 symptoms that are used to diagnose depression are a depressed mood most of the day, significantly reduced interest in almost all activities, significant weight changes, either losing or gaining, trouble sleeping or sleeping too much, moving very slowly or becoming easily agitated, fatigue or loss of energy, feelings of worthlessness or inappropriate guilt, indecisiveness or inability to concentrate, and/or suicidal thoughts. These symptoms must be present for at least 2 consecutive weeks and must cause significant impairment or distress of important areas of functioning. Getting a comprehensive physical evaluation is also important because underlying medical issues can mimic a major depressive episode. Side effects of other medications like beta blockers or antihypertensives or any other medical causes need to be ruled out. The important thing to remember right now is that depression is treatable and there is hope. If you or someone you know is showing some signs of depression, ask for help, talk about it, and listen if someone is telling you they think that something might be wrong. There are free depression screening tests online. These quizzes may give some insight that you may not otherwise have, especially if you are depressed. There are links on my website, but you can find these quizzes at psychcentral.com, depressedtest.com, mentalhealthamerica.net, or dbsalliance.org. Or Google them yourself. This is the internet, and these are just a few of the quizzes that are out there. These quizzes are not meant to diagnose, but can give you some insight that you can take to your physician or your therapist. Psychiatrist Kay Redfield Jamison writes, in Touched with Fire, When energy is profoundly dissipated, the ability to think clearly eroded, and the capacity to actively engage in the efforts and pleasures of life is fundamentally altered, then depression becomes an illness rather than a temporary or existential state. Speak up, find help. Until next time.